Good morning. Thank you for being here. My name is Barry Ramper. I am the President and CEO of Homeland Center and Homeland at Home. 155 years ago, 9 churches came together to provide service and provide an opportunity for widows and orphans living on the streets of Harrisburg to be served. 155 years later, in a year that we're celebrating that 155th anniversary, that same commitment, focus to service exists, changed slightly. Today, we're looking to provide the highest level of quality of care and quality of life to the residents, patients, clients who entrust their lives to us. Today, we're here with an exciting announcement. While in God we trust, we also trust that we will be providing the quality of life and quality of care and earn that trust with a group of patients and families providing palliative care service. To provide more detail and understanding of that service, I'm honored to introduce Dr. David Wenner, one of our assistant medical directors. Dr. Wenner.
Thanks, Barry. Good morning. Good morning. I want to thank Barry for the opportunity to speak today. I'm going to start with, I was going to have everybody close their eyes and visualize 3 patients, but I've sort of taken back that idea. But just relax and think about these next 3 patients that I'm going to present to you. They will be examples of patients who may remind you of people that you know in your communities, in your neighborhoods, even potentially a family member. So we'll start with, imagine for a moment a woman in her mid-50s. She loves gardening and traveling. She has a family with 2 grown children. Grandchildren are not far off. She has COPD, otherwise known as chronic obstructive pulmonary disease, a disease that causes patients to have difficulty with their breathing. She suffers from shortness of breath from her disease, which interferes with her ability to do her day-to-day activities. Next, picture a man in his mid-30s. He's a musician, a single dad. His world revolves around his music and his son. He has multiple myeloma, a type of cancer that produces abnormal blood cells that crowd out healthy cells. He frequently experiences a multitude of symptoms that really interfere with his day-to-day life, his ability to be a musician, and also care for his son. Finally, visualize a woman in her 70s. She volunteers at her church. She loves spending time with her 2 young grandchildren, and also enjoys occasional time getaway with her husband, visiting our country's beautiful national parks. She has colorectal cancer. Her cancer causes frequent long stays in the hospital. Palliative care for each of these 3 examples is a type of medical care that can make life better for each of them. As Barry said, building on Homeland's proud 155-year tradition of providing care in our community, today we're pleased to announce the addition of a home-based palliative care program to Homeland's continuum of services. I'll talk a little bit about that in a few moments. The palliative care program strives to assist patients to improve the quality of their life and their families, providing comfort and relief from the symptoms and stress of their serious illness. Palliative care focuses on the physical, psychosocial, and spiritual needs of patients, as well as their families. In addition to helping patients improve their daily life, palliative care can also improve a patient's ability to receive medical treatments they're receiving. One of the difficulties with all the technology that we have and all the latest treatments that are available to patients are many times they suffer or encounter untoward side effects or symptoms as part of their treatment. Palliative care really works to alleviate and in many cases eliminate some of those symptoms that are barriers to them being able to continue with their life-prolonging treatments. Palliative care not only benefits patients but also family members, as many times family members are part of a patient's journey with their disease. However, palliative care is also confused at times with hospice care. As I'm sure you all are aware, hospice care is really intended for those patients who have a prognosis of 6 months or less, whereas palliative care is really designed for those patients who many times have prognoses that may be years and in sometimes decades. Hospice patients have made a decision in their journey to forego further life-prolonging treatments such as chemotherapy, surgery, or even frequent hospitalizations. On the flip side, palliative care, which can reduce and many times eliminate symptoms, enables a patient to continue with their life-prolonging measures and treatments. So Homeland's new palliative care program will be a new option for patients. So for those patients that are not at a point where they need hospice care, they're still receiving life-prolonging measures. They may not be in a nursing home and therefore don't need skilled services, and they may not be homebound and therefore wouldn't be eligible for home health services. Palliative care will offer an opportunity as another option for patients in their journey with their disease. Not only is palliative care this medical service dealing with symptom management, but it also there's also a component of education. One of the things that I'll leave you with is this discussion many times that we encounter around goals of care discussions. These goals of care discussions are difficult for patients, for families, and in many instances difficult for physicians. Goals of care discussions are discussions that are dynamic, meaning that goals of care discussions for somebody in their 30s who's healthy will look very different than goals of care discussions for somebody in their 50s who has metastatic cancer, comparing that to someone in their 80s who just has a multitude of chronic medical problems whose goals will look very different. At this time, really, it's a big pleasure for me to introduce Dr. Jim Hoefler. I've had the honor really to get to know Jim over the last number of years. He is a professor in the Department of Political Science at Dickinson College in Carlisle. To state that he's passionate and a staunch supporter of palliative care is an understatement. He's the author of a number of books that address aspects of culture, ethics, medicine, end-of-life care, and decision-making. With that, thank you, Jim, for bringing your knowledge to us today, and welcome.
Thank you, Dave, and it's really my honor to be here today with you to help you celebrate this important milestone in the development of Homeland. It's also my great pleasure to give you some very good news for all of you. It falls to me to tell you that this is your lucky day. The good folks here at Homeland have arranged for all of you to receive gifts. Right? Yes, there will be gifts, and these gifts, once you receive them, they'll increase in value as you go through your life, but only if you give these gifts away. So it's confusing, I know. I'll come back to this. In the meantime, let me tell you something important about palliative care. It's relatively new to medicine, and if it's new to you and a little confusing, you're not alone. The word palliative comes from pallium. It's the Latin word for cloak, but it doesn't really enter the medical lexicon until the 15th century when it's used to start describing the cloaking of illness. So that's the first time we see palliative used in that context. But it's not really coming into focus as a specialty until 1987 was the first palliative care service at Cleveland Clinic in Cleveland, Ohio. And then we don't get the subspecialty board certification in hospice and palliative medicine until 2006. That's only 15 years ago, 16 years ago. I tell you this because newness has a real problem. So we know from archaeological studies that people have been filling cavities for thousands of years. We know what to do with a cavity. You go to a doctor and that doctor fills it. We know what to do with a broken bone, right? Doctors have been studying broken bones for centuries. We know what to do with an infection. You go to the doctor, you get an antibiotic. We're doing that since the 1930s. But we all don't know what to do with complex illness, the kind of complex illnesses and the good Dr. Wenner described, the kinds of illnesses with complex symptoms, burdens. But you do know now what to do. You ask about palliative care. You ask if you can have a palliative care consult. See, here's the problem. Sometimes it takes a while for common knowledge in medicine to get out into the community. And the physicians and the nurses and the caregivers, most of whom are around this table here today, they're the chorus. They know the palliative care song very well. But there's plenty of physicians out there and nurses and caregivers who don't know the song that well. And when you don't know a song well, you're not likely to sing it very well. Maybe you just kind of hum along. And there's also patients and their families who don't even know there is a song. But the key takeaway today is that every suffering patient has a right to palliative care, has a right to ask for a palliative care consult. Again, though, the problem is if patients don't know that they can ask for something, they're not going to ask. And they might not be able to get that help from caregivers because they're not fully aware of something like this emerging program here at Homeland. So that's why events like this are so important. And it's why all of you are so important. Because there's no really no higher calling than caring for each other. And many of the people around live here with us today under the tent have years of medical training to help them do that. And thank God for all of you who do that. But the rest of us are now armed with a special kind of knowledge that we can care for each other by sharing what we know. So in a way, I think of us all now as Johnny and Joanna Appleseeds of palliative care. And I invite you all to go forth now and spread the word. Improve the quality of life for those who carry those heavy symptom burdens. Improve the quality of the lives for those who care for those loved ones with heavy symptom burdens. If you know a situation already, you take the opportunity to make the world a better place by telling somebody, have you thought about palliative care? And if you don't know a situation like that, when the time comes, and it will, jump in there and say, you can ask for a palliative care consult. Tell a friend, share with your family, share with a coworker, use the knowledge you're learning today to make the world a better place. So, without knowing it, you now have the gift I was talking about. The gift you have to give away to have it work. And yes, this is your lucky day because now you know something that could improve the life of someone at that most important time in their life when complex illness works to compromise the quality and limit the quantity of time a person has left on this earth. Remember, there's no higher calling than what all of the folks here at Homeland do today. How lucky you are now that you can help in that good work. Thank you.
Thank you, Dr. Hoefler, and thank you, Barry, Dr. Wenner, and the entire Homeland team for everything you do daily to make a positive difference in people's lives here in our community. I'm Don Shell, Chair of the Board of Trustees for Homeland. Homeland is a special organization. There is a strong and real feeling of family among all of us who know and love Homeland. At Homeland, compassion and care are our core. What matters most to the patients, residents, and families we care for is what matters most to us. Yet we know well that the work we do not do alone. Caring for people takes a team approach. Homeland is very grateful to the healthcare organizations and doctors, nurses, social workers, and other clinicians who partner with us to deliver the team approach to care. Those partners include renowned health systems in our region, including UPMC, Penn State Health, and WellSpan Health. We are also incredibly grateful to the many businesses and individuals who generously donate to Homeland, enabling the organization to provide benevolent care to patients. Homeland provides more than $3 million annually in benevolent care. Homeland Hospice patients never receive a bill for services. And Homeland Center never asks a resident to leave because they can no longer afford their care. Our life-changing work also cannot happen without volunteers. We are tremendously thankful for the time, kindness, and commitment of our nearly 100 volunteers to give to our mission. I now invite my fellow board members, Barry, Dr. Wenner, to join me as we officially mark the launch of Homeland Palliative Care. Please join me. Building on Homeland's proud tradition of exceptional care, palliative care will meet patients where they are in their disease process and wherever they call home. Please stay a while to celebrate with us, mingle and enjoy some light refreshments. And please mark your calendars for our Homeland Hospice 5K and Memory Walk, scheduled for Saturday, October 22nd at Ross Moyne Business Center in Mechanicsburg. And please see Myra Badorf, Homeland's development team, for information about sponsorships and registration. Thank you for joining us this morning, and thank you for your support of Homeland.